So now that you know the order of the production process we use to produce sound, we're now going to look at the vocal anatomy that produces those sounds. And we're going to use that diagram in the Google Doc notes that you should hopefully have to kind of follow along. We're not going to go over all the terms that are on this diagram, but you will be able to see kind of the basics that we're going to really take a focus on. So the first thing I'm going to talk about is the hard palate. And essentially, it's the hard part of the roof of your mouth. If you were to take your tongue and just kind of put it to the roof of your mouth, that's the hard palate. Now, if you would take your tongue and kind of slide it back to the back of your mouth, you're going to feel something softer. And that is what's called the soft palate or the velum. And so these are two important things that you may not know about, but they are really important, especially with articulation. They play together with the tongue a lot. So these are two vocal anatomies you may not know about. Then we have the larynx, and the larynx is essentially your vocal cords house. It's the voice box, and so this is where your vocal cords live. And so another part of the vocal anatomy is your vocal cords. They're the things that have to vibrate together to produce a sound in that third step of vibration. Then we have the trachea, and so since the second step is breath, we need to take in a breath from the lungs. And so the trachea is that windpipe that connects the air that we breathe to kind of flow over the vocal cords. Then this is sort of part of the vocal anatomy, the esophagus. There is a branch from your throat to the trachea we just talked about, but there's also a branch to the esophagus, which essentially leads to your stomach. So there is this connection between the esophagus, which is the stomach tube, as well as the lung tube, the trachea. So those are two kind of branches that we have to look at. Then this, right? Since breath is the second step to the vocal production process, the breathing muscle or the diaphragm is a key, crucial part of the vocal production process. And the diaphragm is what actually allows you to breathe. It's the muscle, right? The lung is not a muscle. The muscle of the diaphragm pulls the lungs open and creates a vacuum for the air to flow through. So it's really crucial. So if you've ever been hit in the stomach and you can't breathe, it's because your diaphragm is spasming. It's not able to function. It's not your lungs that are the thing that is able to breathe. It's the diaphragm that's able to pull those air in. So this is going to take a little bit longer than other videos, but because it's so crucial, and some other things we're going to look at is having the diaphragm taking a full breath. So it's from the stomach, it's not from the chest. That's not what you want to do. What you want to do is have a full deep breath from the diaphragm. So if you place your hand on your stomach, you're able to see that. So this is a really crucial part of the vocal anatomy. Then I'm going to kind of pause the video here so that you can kind of debrief that and maybe play around with diaphragm.